Hey everybody, Chris Hayes here from Hayes Physical Therapy. Today I want to share with you the most impressive journey that I've ever been on with a physical therapy patient in 31 years. It is a story that is quite emotional. It's a painful story. It's an impressive story, but it's also a story of healing and hope. And I want to, without further ado, introduce you to Jim. Jim and I came into each other's lives about 5 years ago. And he practically crawled into my office and was in an incredible amount of pain. And I'm going to let Jim sort of share with you. Jim, tell us about your injuries and what got you into my practice and what you had been through.
I worked railroad construction for 32 years. I was in an accident. I was cutting a piece of welded rail that was under pressure, and I thought I was in the right spot, and it snapped and caught me under my butt and threw me almost 20 feet. And all I remember waking up is my brother standing over me going, "Oh my God, somebody do something for him." And my legs were numb, everything was numb. I thought I was paralyzed. We got in the ambulance, got to the hospital, and things started to come back. I missed probably a month of work just from the pain. And I went back to work. Probably way too soon, but I kept working. I worked for another year, and then I finally got my first operation. I couldn't take the pain anymore. After 3 of those surgeries, I had a bunch of injections that didn't work at all. I kept going back to work, and then they decided we had to fuse. I was in bed for 6 months, did not move, waiting for a proper surgeon to take care of me. They finally did. I was in bed for another 9 months, body cast, double fusion.
The fusion, and that I believe that was both 2 segments, right? L4, L5, L5S1.
Yes, it was. That was 7 years after my first surgery. We had that done. I said I was out for a year of work again. Still haven't met you yet. Went back to work. I was fine for 7 years almost. Worked out every day. Worked every day. Everything was fine. And then something started going wrong in my hip that would bend me over. It felt like someone was stabbing me just every step I took. And of course, I waited 3 more months, tried to put up with it, tried to put up with it. I could not anymore.
Was that the time was that before or after the time when you helped to lift your dad? When he was in the hospital, your dad had Parkinson's, and you did try.
That was after I had started seeing you.
Okay.
We started seeing you. My uncle had said, "Look, you got to go see this special PT specialist, Chris Hayes." I said, "That's fine, I'll do whatever I got." The first night I got here, I literally crawled up the stairs. That was probably one of the worst pains I've ever had.
Yeah.
Met you tried to treat me. I remember diving off the table, grabbing you, just making you stop doing everything, and we got Talia mixed into it.
Yeah, Talia's our acupuncturist, and Jim was in such severe pain that I was grateful that Talia was actually in the practice that day. She's part of our integrated healing center. And I said, "Talia, help out here." So she tried to also calm the nervous system down, calm the muscles down with her needling, and we were both really blown away by the level of pain that you were in. And at that time, I remember, there was a decision on the table whether you were going to have another surgery, which was to fuse your pelvis to your sacrum. Just because you were in such dire pain, we maybe only did 3 to 5 PT visits, and you decided to go ahead and have that very unique surgery.
Mm-hmm.
And after that, even worse, right?
The surgery did nothing. I got out of that waiting a month, and the pain just ramped. I could not even stand on my left leg. It felt like someone is just stabbing you, stabbing, until the point where it felt like someone just left a knife in there, and you literally have to work around that knife. Don't let you get used to the knife being in your spine.
Yeah.
But you got to make sure that knife never gets touched. That knife never moves. That's how you got to live.
Yeah.
Everything is.
Yeah. And I remember from that point on, we did a combination of acupuncture, some craniosacral, very gentle, myofascial, even some energy-like healing work. That we did just to sort of try to get you back as best as we could. And I remember that process taking at least 6 to 9 months before we could actually even try and exercise. That's how impressive. And from my perspective, your nervous system was on fire. and it was causing such crazy muscle spasms everywhere. Every step you took was excruciating and painful. You weren't working during that time, right? You had to stop pretty much. Yeah.
Lived on the couch. All I do all day long, couch to the bed. You don't sleep. You just go to bed because you're supposed to go to bed. You just stare out the window all night, wait for it to get light, and then all day you just wait for it to get dark so you go back to bed and pretend like you're going to bed.
Yeah. And fast forward, we really worked with Jim for several years trying to get him better, and got even to the point where I know you were taking a lot of opioids. You came off the opioids. I remember you sharing that you did the CBD, didn't really affect you in any kind of way. I even went with Jim to, see a surgeon to do a pain management doctor to put in 2 spinal cord implants, which is kind of a last resort, just to see if that could, alleviate some of the pain, because not only was Jim experiencing the stuff in his lumbar spine and down his legs, but he also had some injuries that were coming together in his neck from stenosis and some herniated disc in the neck, and he was getting no relief with injections, no relief with SI injections, epidural injections. There was nothing that was giving you relief. We were hopeful for the spinal cord implants, but what was your experience with those?
The implants, they worked for a little bit. They kind of took the pain away, but the more I started to realize, you go to the grocery store or something and you're on it for 20 minutes, you don't realize what you're doing to yourself again. And when I would turn it off, I would get back into that mode where you can't get out of the pain again. And it just basically was just hiding the pain. And that wasn't good at all. I'd rather know what I'm doing so I know when to, all right, that's enough for today. Go sit back down, go lay down.
Right.
Don't move.
It was pretty impressive. We do a lot of manual therapy in our practice, and I'm also trained in energy healing work, and it was really the most impressive case that I've seen in 31 years. I've shared that with you. And the other piece is that, so we got to a point where I couldn't even work with Jim. You couldn't even touch Jim. Even the thought of, laying your hands on him, he would go into it, such incredible muscle spasms. So we kind of, unfortunately, sadly said, I don't think there's anything more I can do for you. And then Class 4 laser came into our practice. Some PTs that I dialogue with across the country who have been using Class 4 lasers for a number of years said, Chris, it's a game changer. All the professional sports teams use them. All the high-end athletic programs and universities use them, and patients get better. And I was a little skeptical about it, but nevertheless, I decided to bite the bullet and bring a Class 4 laser into my practice, and immediately called Jim and said, hey, listen, I have something. Let's try it with you. It may, give us some results that we're looking for. And I think fair to say that both of us have been pretty blown away by the effects of the laser.
Absolutely.
So tell me a little bit about that.
Well, I was literally at the end of my rope. I mean, with everything, I could not get relief. Like I said, I'm up 24 hours a day. You just lay there in pain. I had to quit the pain meds because they were going to kill me. I was taking almost 20 of those a day just because you got to take 4 at a time just to kill everything. Nothing worked. Then Chris, out of the blue, calls me and says, I have this new treatment I want you to try. I will try anything at this point. We came in, the first couple sessions went okay, didn't really notice too much. About the third one, you started to notice little things. The more we gone on, I walked in one day and I walked right up the stairs. And I stopped and I said, oh my God, I walked right up the stairs. You don't realize what you're doing until you do it. Today I put on tied shoes. I haven't done that in 2 years. I can actually bend over and tie my shoes. I mean, that sounds dumb, maybe, but to me, that was 2 of the worst things I could do. The grocery store, I used to walk around there, fill my cart, leave the cart there because I couldn't take anymore, and just go home, starve for 2 days or until I could get back out of bed to go get food again. The laser, now I can walk around the store, no problems. You walk around, like I said, you can tie your shoes. I can sleep. My God, the first night I slept for 8 hours, it felt like I melted into the bed. I've never felt anything like that. It was just a big wash that came over me. I was like, oh my God. 5 years of pain washed away. Unbelievable.
And before that, you said that maybe you can only get about 30 minutes of sleep.
Yeah, you only sleep because you pass out because you're so tired. There's no way to sleep. You wake up, you're just dead. You watch TV for another 4 hours. You don't really see anything. You just lay there, pass out. That was my day for 2 years.
Yeah. The other day you shared with me that you were able to stand, you were watching a construction project, you were able to stand an hour, which, you know, these things might sound like little things to some people, but seeing the impressive amount of pain, I've never seen anything like it in 31 years. And the laser, I'm just so blown away.
Yeah.
You know, and you know, some of the effects of the laser is that it really does decrease pain and inflammation. And we're treating that directly over the spine and over the peripheral nerves from the spine and into the muscles. It also stimulates the immune system, and it also promotes natural healing. So it's one of the things that, you know, there's no placebo effect with you. You know, there's definitely no placebo effect. They also use laser with animals and stuff like that. There's no placebo. It either works or it doesn't.
Right. Just I wouldn't be able to do what I'm doing.
Yeah. I just, I've been blown away. You know, the day I saw Jim walk up the stairs and he forgot to take the elevator, I just was like, you gotta be kidding me. You know, and just everybody in the practice has seen those changes. You can see, you know, you can see it on your face, you can see it in your whole persona. You know, now you can actually, you know, touch you and you're not flinching and jumping with pain. You know, from an emotional standpoint, you know, so physically I know that that's, you know, been pretty impressive, and we're not done yet. You know, we're still working that, and we're going to still try to integrate movement, start get you into the pool and do some gentle stuff and some walking. But from an emotional standpoint, you know, what impact has this had on your life? Without the laser, what, you know, where do you think you would have been? And then
I literally don't think I'd be sitting here with you right now. I didn't know what to do with myself. I sat in that house all day by myself, day after day, never going even down the stairs and see another person. Can't be touched by another person. Now I can get out of the house, you go out and you see people. I mean, it's such a mental relief. I mean, honest to God, I don't think I'd be here right now.
Yeah, yeah. Well, thank you for sharing your story, Jim, because it's been impressive, and you know, I'm also thankful for you, and I'm thankful for the laser.
Thank you so much, Chris. There's no way I can repay you or this whole your whole.
Just that smile on your face and seeing you climb those stairs and just getting a piece of your life back. I mean, you just can't imagine. You
just
know,
one little thing at a time, and before you know it, you're up there.
Yeah, for sure. Thank you, Jim.
No problem.